If you're a new mom, then this video is for you. Hi, I'm Lakshmi Tejasvi. I'm a clinical and sports nutritionist. So in this video, I'm going to talk about what are the best foods that you need to have and what are the nutrients you need to concentrate on if you have just delivered a baby. So once a mother delivers a baby, she's under extreme stress in the body, physically as well as mentally. So we need to calm down both. So the first most important food nutrient that we have to take care is about protein. So if whether you have undergone a normal surgery or normal delivery, or if you're undergone a C-section, you need to concentrate on taking a good protein rich diet because that helps you in healing faster. And if there is any tissue repairs or tissue damages, then that helps in the healing of the tissue repairs. So protein should be a little higher than your normal intake of every day. So if you technically speak, and to be more precise, you can go up to 1 gram per kg body weight or a little more than that of 1.1, 1.2 grams also. But again, this depends on what is your height, weight before your pregnancy, during your pregnancy, and after the delivery, what is your weight also. So it differs for everybody, so it should not be generalized. And especially for C-section, protein should be concentrated a little more higher. 1.2 can be the minimum that you start with. You can go up to 1.3 also per kg body weight, so that because it's a surgery, and surgery means there is some kind of a tissue damage also, and there is inflammation. So to reduce that, you require a high protein diet, but concentrate on eating the right type of protein foods and don't concentrate on eating a generalized protein foods for everybody that have. So when I say protein rich foods, don't just concentrate on eating only eggs or meat and anything like that. And don't, for vegetarians, they think paneer is the best protein food. Don't concentrate on paneer because it also has high fats. So have a very balanced intake of protein. So foods that you can take and should be you can take eggs but not excessively. You can take chicken, you can take fish. These are the best protein rich foods that you can take. Avoid having mutton, red meat, okay, and prawns because they're also a little high in cholesterol. That's the reason why we ask you to avoid. Of course, somebody who's vegetarian, you can have dal. That's your best protein rich food, and as well as curd and buttermilk are also good in protein. So you can take a thick buttermilk with your everyday meal. So make sure that not one meal, but every meal has some protein food. If you're having breakfast, there's one egg at least, and then with your lunch and dinner, either there is dal or some chicken or you have some curd and buttermilk, a good portion, so that it is balanced and it is also giving you a good amount of protein. So the next nutrient that we have to concentrate on is omega-3 fatty acids, because these are healthy fats. These healthy fats reduce your inflammation that you have in the body, as well as helps in your brain health. So because mentally also mothers are very tired and exhausted, and they do have a lot of mood swings because of the hormonal changes. These omega-3 fatty acids, they can reach your brain cells very easily, and that's the reason you should concentrate on taking these foods. So what are these foods that are rich in omega-3? Are flax seeds, chia seeds, walnuts. These are the best seeds and nuts that you can have, but don't overdo them. So there are a lot of times that a lot of them do is they take like a handful of walnuts or a handful of these chia seeds or flax seeds and consume them at one time. Don't do that. Take 1 teaspoon or 1.5 teaspoon in a day, not beyond that. 1 to 2 walnuts in a day or 3 walnuts in a day is good enough. So these omega-3 fatty acids not only are beneficial for the mother, they're also very beneficial for your child's growth and development also. So next nutrient, extremely important for a new mother who's just delivered, is fiber rich foods. Reason is because they can't move much, they're in a lot of pain, so they feel very constipated or bloated and gassy. So when you eat a fiber rich diet, you can reduce these symptoms of constipation and bloating and gas. So improve your gut health overall. So constipation is very, very common symptom in most of the 90% of the mothers. So make sure your fiber rich diet is there in every meal of your day. Like fiber rich are salads, and fruits. These are the best fiber-rich foods that you can find them easily at your home. So having at least 1 to 2 fruits in a day. Don't have fruit juices that will remove the fiber. Have a whole fruit like a whole apple or a whole orange or a pineapple, 2 to 3 slices, that way. And salads every meal, like your breakfast, lunch, dinner, make sure you're having a salad. It need not be an elaborate or a fancy vegetable salad. It can be as simple just as one cucumber and a carrot mixed, or beetroot and carrot mixed, like that. So simple. Don't grate them. When you grate them also, the fiber rich content will also reduce. So try to have them as round slices that are cut or big slices that are cut. The next most important nutrient that you should concentrate is fluid and water intake. So make sure you're hydrating yourself as much as you can so that you don't feel dehydration. It improves your gut health, reduces constipation issues or any bloating issues. So drink as much fluid as possible. That can be just plain water, or it can be coconut water or buttermilk also. Or if you're able to have lemon water, if you don't have any acidity issues, you can also have lemon water. The vitamin C that is present in the lemons also will help in reducing inflammation. So I hope you found this video useful, and if you have any further queries, anything that you want to know how we should tackle with each person's personalized nutrition, leave a comment below. Please like, share and subscribe to our channel.